Erythromycin, also known by the trade name E-Mycin. Erythromycin is indicated for the treatment of upper and lower respiratory tract infections, otitis media, skin infections, pertussis, syphilis, and rheumatic fever. Erythromycin works as a bacteriostatic agent, suppressing bacterial protein synthesis. The therapeutic classification of erythromycin is an anti-infective agent, and the pharmacologic class is a macrolide. Special considerations for nursing include that erythromycin may cause QT prolongation and ventricular arrhythmias, and in high-risk cardiac patients or those on other QT prolonging medications, including antibiotics and antipsychotics, a baseline EKG and a follow-up one in a week should be considered. Erythromycin is a prokinetic agent, and therefore diarrhea is a very common side effect. Infection status should be assessed while on erythromycin, and liver function tests should be monitored. The medication should not be shared with others, and patients should be instructed to finish their entire medication regimen, even if they are feeling better, to ensure to eliminate subclinical levels of bacteria still in their body. An interesting drug interaction of note is that in patients with calcium channel blocker therapy also on board, they have an increased risk for hypotension and shock when taking erythromycin, especially at high doses or for prolonged periods. As mentioned, erythromycin is a prokinetic agent, and sometimes it is used off-label with this as its purpose, most commonly in patients with diabetic gastroparesis to promote motility, and as a pre-medication prior to NG tube insertion to ensure that gastric contents are emptied and moving appropriately.
Visit nrsng.com/50meds for our free cheat sheet covering the 50 meds every nurse must know. That's nrsng.com/50meds. This has been another MedMaster podcast by nrsng.com with your host, licensed pharmacist Cody Magnuson, BSc, PharmD candidate. Now, from all of us at NRSNG, thanks for being here and happy nursing.